Hi, everyone. It's Dr. Taylor again from the University of Minnesota, and I have with me Dr. Jaya and Dr. Page, who are here to talk to you today about mental health. Dr. Jaya, can you tell us a little bit more about what mental health is?
Sure. So, mental health is how a person feels on the inside and is often referred to as their emotional and social well being. You may hear of people having things such as depression or anxiety. This isn't when people feel really sad or worried, and these feelings make it hard for people to function in their day to day lives. Mental health affects adults and kids of all ages, and it is really common. There are many reasons for why people feel this way, and there might not always be a good reason. Regardless, it is important to talk about and get help. As doctors, we know that mental health can impact how people feel physically, and we want to make sure that you are mentally and physically well.
Thanks for that, Dr. Jaya. COVID has definitely been affecting the mental health of our patients and families. Dr. Page, could you tell us a little bit more about this?
Sure. In a time of uncertainty and isolation like the pandemic, it's very normal to be feeling more down, more anxious, and more alone than we have been before. A lot of people are feeling this way because we have to separate from our loved ones to keep everybody safe. Not being able to go where we used to go and do what we used to do can make us feel sad or depressed. Not knowing how or when the pandemic will end can make you feel more worried or anxious. These feelings are all very normal, and it's okay to be feeling them. They can affect our ability to eat and to sleep and to communicate well. Children especially have been affected by COVID. Their routine in regards to school and childcare have changed. They may have missed major life events like birthday parties and graduations and holidays. The way they're used to learning has certainly drastically changed, and they aren't able to interact with their classmates and their friends the way they're used to. This is why it's so important to look out for signs and symptoms of depression and anxiety.
Yeah, Dr. Jaya, what are some signs and symptoms that parents and loved ones should be looking out for?
Sure. So sometimes people will say they are down or sad or worried, but oftentimes in kids, the signs can be a bit different. Kids can show sadness with changes in their behavior, trouble sleeping, headaches, stomach aches, or trouble eating. Kids with anxiety may be scared of situations or places where they were previously fine. When in doubt, speak to your doctor about the symptoms that you or your child are experiencing and if it is appropriate for you to see a mental health care professional. Sometimes they may recommend talking to a therapist after a stressful event, even without signs of mental illness. With the pandemic, lots of places are doing telehealth appointments, and you may not even have to leave the comfort of your own home to get help. There are many different kinds of therapies and medications, so if you find that what you're trying out isn't working for you, don't be afraid to ask for alternatives. But call 911 if you or your child is having serious thoughts of harming themselves or others.
Thanks for that, Dr. Jaya. Dr. Page, what are ways that we can support ourselves as well as our family as we try to navigate through this pandemic in regards to mental health?
There are so many ways to support and strengthen our mental health, even during a pandemic. Weather permitting, taking family walks can be a great way to support your mental health. It allows for time away from looking at screens, allows with bonding with the family. It's a change of scenery. It's time to be active, which we know is great for our health, both physically and mentally, and fresh air is good for our mental health as well. Maintaining a routine can be a great way for children to know what to expect from their day and help feel supported. It's important to talk about your feelings freely and name feelings to help support your child's mental health. Are you sad that you can't go to your favorite place? Do you miss your friends? And reassure children that they're safe and reassure them about their well-being. It's so important that if you are in need of help, ask. It is also really important to continue going to routine healthcare visits, even during the pandemic, as your provider can be a great resource for you and your child's mental health.
Well, thank you so much, Dr. Jay and Dr. Page. That was really helpful information. I'm gonna share this resource with you all. And this is a really wonderful tip sheet from the Department of Health that talks about 16 ways to find your happy place and to reduce COVID stress. I think this is great for kids and families. And there's also some helplines available. Thanks for listening, and we'll see you next time.